video we'll talk about acute sinusitis. The object of this lesson, you will understand about the clinical feature, sinusitis in adult, sinusitis in children, treatment, symptomatic treatment, antibiotherapy, and other treatment. Definition: acute sinusitis is an inflammation of one or more of the sinus cavities caused by an infection or allergy. Most acute sinus infections are viral and resolve spontaneously in less than 10 days. Treatment is symptomatic. Acute bacterial sinusitis may be primarily infection, a complication of viral sinusitis, or of dental origin. The principal causative organisms are Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis. It is essential to distinguish between bacterial sinusitis and common rhinopharyngitis. Antibiotic therapy is required in the case of bacterial sinusitis only. Without treatment, severe sinusitis in children may cause serious complications due to the spread of infection to the neighboring bony structure, orbit, or meninges. Now, we talk about the clinical feature. The clinical feature of sinusitis in adult: pleural, unilateral or bilateral discharge, nasal obstruction, and facial, unilateral or bilateral pain that increase when bending over, painful pressure in maxillary area or behind the forehead. Fever is usually mild or absent. Clinical feature sinusitis in adult: same symptoms in addiction, irritability or rigidity or cough or vomiting may be present. In the event of severe infection, deterioration of the general condition, fever over 39 degrees, periorbital or facial edema. Now we talk about the treatment. Symptomatic treatment is fever and pain. We talk about later that talk about the symptomatic treatment, fever and pain. Clear the nose with the 0.9% sodium chloride. Now we talk about antibiotherapy. In adult, antibiotherapy is indicated if the patient meets the criteria of duration of severity of symptoms. Oral amoxicillin is the first-line treatment. If the diagnosis is uncertain, moderate symptoms under 10 days, and patient can be re-examined in the next few days, start with the symptomatic treatment as for rhinopharyngitis or viral sinusitis. In children, antibiotic therapy is indicated if the child has severe symptoms or mild symptoms associated with the risk factor: immune suppression, sickle cell disease, asthma. Oral amoxicillin is the first-line treatment. Oral amoxicillin for 7 to 10 days. Children, 30 milligrams per kilo 3 times daily, maximum 3 grams daily. In adult, 1 gram 3 times daily. In the event of failures to respond within 48 hours of therapy, amoxicillin clavulanic acid PO for 7 to 10 days. Use formulation in a ratio of the age 1 or 7 1 exclusively. The dose is expressed in amoxicillin. Children less than 40 kilogram, we use 25 milligrams per kilo 2 times daily, and the children who over than or equal 40 kilograms and not ill, we use ratio 8:1. We use the 2000 milligram daily. It means that 2 tablets of radio 500 and 62.5 milligrams 2 times daily. If we use the radio 7.1, the dose is 1750 milligram daily. It means that we use 1 tablet of 875 and 155 milligrams 2 times daily. The ratio of amoxicillin and clavulanic acid varies according to the manufacturer. Radio 8:1. 5 milligrams amoxicillin and 62.5 milligram clavulanic acid tablet, and the 500 milligram amoxicillin and 62.5 milligram clavulanic acid 5 milliliters powder for oral suspension. Radio 7.1. 875 milligram amoxicillin and 155 milligram clavulanic acid tablet. 400 milligram amoxicillin and 57 milligram clavulanic acid 5 milliliters powder for oral suspension. In penicillin allergic patient, erythromycin PO for 7 to 10 days, children 30 to 50 milligrams per kilo daily. And in adult, we use erythromycin adult 1 grams 2 to 3 times daily. Thank you for watching. Don't forget to click subscribe and comment to feedback my video. Thank you.